So the next thing I'm going to go through is how to administer the medication. Some of you have met Mama Cat before. So one of the biggest things is that you don't want to just go in and just sort of start doing it right away. You want to get your cat, as I have in another video said, used to just having their mouth handled, their lips pulled back, doing all the things that you might do when you're giving them the medication. So when you touch their face every time, it's not a negative experience. So Mama gets a lot of handling and she does get medication every day, so she's fairly used to it. So the thing that I recommend is we want to make sure that you have good control, and the best way to have control is to have a lot of points of contact. So when I go to give her medication, if I'm holding her, we talked about the football hold, I'll use that sometimes. Or if I'm holding her head and I don't need to hold her entire body, my hand is going to be basically resting right on her head. And I'll go to the side and you can see the fact that it's right on her entire body, down her back. And we're basically just making her head and my hand an entire unit so they move together. When we go to give the medication, so we're going to pull her bottom jaw down and we're going to basically stabilize her head. And so you can see me holding her mouth. And then I'm just gonna open her bottom jaw and then put the medication in. Okay, so Mama is on a specialty diet because she has allergies. So she is not going to get a pill pocket, but I will give her her regular food to do this. Oh, she's excited already. So, tasty, tasty treat, hand on the head, as much point of contact as you can. Pet, 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 pull the head back, pull the jaw open, pop the treat in, and then give some rubs around her nose, around her face, and she's licked her tongue, so that tells me that she's swallowed the medication. So what I see a lot of people do is they come in and they try to get in there and everything's moving around and they don't have a lot of control. So it really is point of contact, good control, stabilize, move the bottom jaw. And then if you need to, if your hands are just behind their canines, then you can sometimes just sort of push their mouth open a little bit as well. Okay, so once again, we're just stabilizing. We're gonna get our finger and our bottom teeth there. We're gonna open her mouth and then we're gonna put the medication in. So I'll show you on a different angle, just so you can see it from the side. Okay, so Mama Cat, pet, pet, pet. Really happy, nothing's happening here. Oh, pop it in, there we go, good. Okay, some people want to use things like these pill poppers. You can use them if you really need to, but what I often find is that people end up putting the medication really far down the throat when they use this, and then the cat ends up gagging or it's a negative experience for them, and then it's harder to do in the future. So what I recommend most owners do is start handling their cat, especially your kittens, for their future medication needs. Get their food or get a treat that is fairly soft so that you're not hurting the back of their throat, and just get them used to eating their food, having you give them the food. Oh, sorry, Mama, here we go. Because that's gonna make it easier for you to give them their medication, because they get used to the idea of you handling their mouth and it be something that actually tastes good. Okay, thanks, Mama.